As the NHS continues to battle coronavirus, at least 10,000 fewer patients are being treated for non-COVID issues. But how is coronavirus impacting the support given to non-COVID inpatients?
I went into hospital in November because I had a cancerous polyp in my rectum. Not too nice, unfortunately, but it required quite major bowel surgery and an ileostomy stoma bag. So I went in to have that done. And unfortunately, after, my post-operative care was basically horrendous because there was an outbreak on the ward that I was on, and there was nothing in place on that ward for the event of a COVID outbreak. And that is how many months on? A year practically since COVID actually has been happening. So ridiculous, and just a stupid situation that was not coped with by infection control. So if they had nothing in place, then how on earth is that hospital running for normal patients? The good nurses and the good staff are being pulled in all directions. They're being used on different wards for different things. And then they're backing up, especially at night time, with students. So you're dealing with nursing staff that don't have the right skill sets. They might be okay, but they don't know how to deal with you properly, and they don't see the vital signs of somebody who's practically failing after an operation. And I would say that also that most of the staff on the ward that I was on they're almost mutinous. They are defensive. They're trying to do their best. Some are better than others, and they are desperately struggling. They're definitely understaffed. They try and use agency nurses who are notoriously not good enough, and they think they have a whole quota or a full staff for the night, and they can be let down by 2 or 3 people, and they cannot get any more staff on the spot. So they're running these wards understaffed.
Patients that are in hospital for COVID or have developed COVID and are like on oxygen because they need it, they do have more needs because they can't do anything for themselves.